Welcome to Health Talk. Today we're going to talk about innovations in medicine. We have with us a full studio, Dr. Paul Wang, Professor of Medicine, Stanford University School of Medicine, Director of Cardiac Electrophysiology and Biodesign by courtesy. We have with us Kimberly Pham, BS from Cal, who majored in molecular biology and has done research about computational projects. And we have with us Evelyn Ross, Masters of Public Health, University of Iowa. So, innovations in medicine, it sounds really good. Why do we care as the public? Why?
Great. So some of the greatest promise for advances in medicine will come with truly great innovations that will really provide new ways in which we can diagnose and treat medical problems. So I think we have really great reason to have optimism about an explosion in terms of new advances and innovations in medicine.
So innovations in medicine, I know you've been involved in cryocath, which is an invention in catheter ablation using a different type of energy. So tell us a little bit about that and how you got involved in innovations in medicine with biodesign at Stanford.
Sure. I'd love to, that's a great question. I'd love to talk to the audience about how medical devices and new innovations come about. And so there are many different ways in which I think needs are identified. That's really the biggest principle that I think most people in innovation embrace, and that is to really identify what is the clinical need, what is the gap in terms of our ability to either understand, diagnose, or treat a medical condition. So in doing that, we can have a really good idea about what direction to go in. So it really starts with, I think, a very precise and comprehensive understanding of what the clinical need is. So in one situation, one might do that based on observation. One might see that in your own experience, you've observed that really there are major limitations in our abilities to make advances and to treat a certain kind of patient in a certain condition.
You mean to fix a problem. The problem still needs a solution.
Exactly. And so understanding that need is really where innovation best comes from. So I think that though we might start with technology, we might have a perspective that a certain kind of technology might be applied to medical problems. The greatest degree of advance and the greatest fruit comes from when we've identified and paired those two things. That is, new approaches with this really important need. It's that pairing of the need and the innovation that really leads to success. And I think that's the major thing that we've learned in terms of the process of innovation in the last few years.
Now, for example, you're in the public health arena, and there are many problems such as clean water, and that affects cholera, and that affects disease, hepatitis. So when you were in Iowa, what kind of things do you think there's a problem and that there's an engineering solution?
Oh, there's all sorts of things. I mean, maybe not specific to Iowa, but I think that we've seen a lot of really exciting like 3D modeling and just kind of different computerized models that help a physician or help a team kind of optimize the treatment plan for a person, or help optimize how someone can get from point A to point B. So I guess in particular, I've heard a lot about 3D printing, and so I don't know if you've seen that in medicine now, but could you tell us a little bit about that and how that is going to change treatment for us?
Sure. For the audience, 3D printing is a new innovation that I think is going to revolutionize much of what we do in all of technology, including in medicine. So this is based on a technique of creating a three-dimensional structure, a real object that we can use and hold in our hands. And so the way it's done is using sophisticated computer design software, very much like what an architect uses to plan a building, and engineers have used for many years to design objects that they're going to create. But what the difference is that final ability to automatically translate that design concept and those design features into a physical object. So literally, once one is finished the ability to design it in the computer, one has to simply stand back, push a button, stand back, and watch it happen. So the way it's done is that the computer identifies for each area the parts of a flat surface that are in fact to be imprinted. And so it will go in very fine layers, much like making a multi-layer cake. And so once one can do that, very often microns at a time, that one can create incredible resolution of a physical object. So that can be used to create a part for a machine. It could be used to develop a model, as we use in medicine, that might be able to specifically take someone's own image of a part of their body, an organ, and to be able to understand that better. And then eventually to develop devices, prototypes that it could in fact be used and tested for a certain kind of function. So I think in all of the world, in our daily lives, we'll see 3D printers, just as copy machines become part of our everyday life. And printers, we may have a printer in our own home that will print a picture or a photograph, and we'll probably have a 3D printer in our home that will print various different parts. And so that kind of same dissemination will happen in medicine, that every operating room, every laboratory will have a 3D printer and be able to then develop these kinds of tools very rapidly and very easily. In our own experience, the 3D printing process has been particularly exciting because as we're doing the development of new medical devices, the prototype stage is really an essential part of the process. And so when we say prototype, we mean typically to make something that will serve a purpose, that we will then be able to understand whether in fact we've designed it correctly. So that in years past would have taken potentially months to create one prototype. We would find an engineer who could make the correct prototype to our specifications. So maybe 3 months later I'd get something in the mail that would, in fact, I would look at and say, well, what about changing it a little bit differently? And another few months would go by. And so one can imagine the innovation process is much slower. Now what we can do is we can go to a computer, make those design features that we want, and then overnight come in the next morning and the entire prototype is complete. So we can iterate in a much more accurate and real-time way that we could ever do that. So I think the whole 3D printing technology is really going to transform and revolutionize what we can do, both outside and inside medicine.
Now, Kimberly had some questions before we got to the studio about the 3D printing version of the heart. Kimberly, why don't you ask Dr. Wang?
Yeah, so I've heard a lot about new research and like how people are trying to come up with a 3D model of the heart. So like, are there studies right now that have tested that or have shown that like it would be viable in patients?
Sure, it's a really great question and a very exciting area where we're really trying to take many features, whether it's the heart or other organs, and be able to then take the image, take imaging information that we have, and then translate it into, in fact, either a model or a device that could be used to fit that kind of structure. So it's really wide open, and I think in terms of what we expect to see. There are just many ways in which we'll be able to adapt to the person, so-called very personalized kind of an approach to the innovation solutions that might exist.
Now, you had created a 3D model of the heart and was written up in the San Francisco Chronicle, and you had used software like the CAD, like architects and designers. Tell us a little bit about that.
Sure. So again, I think this is a great example where different parts of medicine and science have merged. So we've taken techniques which were certainly developed by engineers, draftsmen, and architects to be able to really design different 3D structures. And so to be able to take that in a software environment and then connect it to a 3D printer is really extraordinary. So I think that's really where the speed of innovation really comes. The ability to manipulate something on a computer and see it become reality in such a short period of time with enormous precision is really extraordinary.
Now, in the 3D model of the heart that you've created, what uses do you envision that?
Sure. So I think a great question. I think so many. I think once we're able to really, in a rapid way, take the individual's image and to be able to then make not only calculations, which we can do on a computer, but in real life really understand the exact three-dimensional relationships, that'll be very helpful. So in many surgical procedures, that'll be helpful. Many catheter-based and non-invasive or minimally invasive procedures, that'll be helpful. We'll be able to use many of those different abilities and advances in terms of technology. And it'll allow us to compare patients in a different way as well. And indeed, I think, advance our ability to innovate.
With the 3D printing available in the future, I was assisting somebody in an orbital floor fracture, and they had to create a plate for underneath the eye to simulate the floor of the orbit.
Yes.
So it would have been much nicer for us to just put in the dimensions of that floor, which we know what they are from anatomy and from our experience, than for us to physically cut it out, you know, measure it repeatedly to sit it if it fits into the floor. So I could see that for ophthalmology it would be absolutely fascinating, and also our incisions are sometimes 1 millimeter or just a very, very small, or in terms of microns. And what we're looking at, if we could just create that and we could patch up the retina without sutures or whatever, it would be so much exciting for us in ophthalmology. Now, you're in biodesign. It's a very interesting division, you know, department of Stanford, and they have global centers as well. What do you want to tell the home audience? What's exciting about biodesign and for the world?
Oh, terrific. So biodesign is a program created at Stanford, really designed to bring together a community who are most interested in medical device innovation. And so this is an area where there's enormous capability, because it really comes from developing new technologies, new treatment strategies that will really lead to large benefits for all patients. And so this program, founded by Paul Yak, cardiologist at Stanford, is really designed to try to teach people innovation. So one of the very first questions that he faced was, can you teach innovation? Is it possible? Are innovators born, or are they created? And so I think he and the leaders in the program have in fact shown that it is something where you can learn very important tools to be quite successful and be very innovative in terms of their what they're able to create. So this kind of interdisciplinary approach, which is what we hear a lot about, really has come to fruition in being able to bring people with business experience in medicine, engineering, other areas together, so that they can work and develop a strategy to be able to innovate. And I think we've seen it work very successfully.
Now, to be devil's advocate, as we're heading into a tougher economic climate globally, how can we continue innovation and be cost effective?
Yeah,
That's
wonderful.
also a challenge.
Wonderful, yes, absolutely. I think what we have sometimes thought of innovation as being cost increasing. We've thought, well, it's a new device, it's going to be expensive, and that's the way it is. And one of the things I think we've learned is that many strategies, many kinds of treatments can actually reduce costs, not only in terms of improving productivity of the patient, that is in terms of work, fewer days of sickness and being out of work and getting back to work more quickly, the overall even cost of the care that the patient receives can be much less. They can be in the hospital a shorter period of time, require much less in terms of post-operative management. So there are a lot of ways in which costs can be reduced. And so I think that will be a major focus for new device development as well as other innovations in medicine to make sure that not only are the outcomes better, but in fact we're using resources well and more efficiently. So I think that'll be a big focus that I think people in innovation are very aware of and will come up with really good strategies to do that. And so I think they're very much attracted to often novel, the most innovative solutions are ones that will, I think, have very dramatic in improvements in outcome and cost. So that's really where I think we'll be seeing a lot of development and a lot of convergence of interests, not only in terms of disseminating new devices in practice, but in terms of making it more cost effective and ultimately having greater access. So large segments of our population can in fact access those kinds of technologies and not be restricted to one part of the population.
Now, Stanford's been a leader in the world with massive online courses and management of massive data, large, big data. And it's also having a role in medical education. Can you comment about that?
Yes, oh, absolutely. I think as many of you have followed, online curricula have become a major area of educating the world. And I think in medicine, there's a particularly great opportunity, and that's in many different respects. So one is I think that it's a vehicle to educate the general public. In a way we could never do before. We really were not able to reach out to the public at large and educate them about health problems. In a similar way, the most experienced people who are specialists in an area, people in medical education, people who are learning medicine, it's a really great way to educate people in an efficient way, in a way that can be very dynamic and really lead to, I think, better learning overall. So we've got a lot to learn, I think, about how to do that the best way, but I think I'm very optimistic that we'll be using in the future all these tools to educate future physicians in a very exciting way.
Also, there's more global outreach for medical education if we could give massive online courses so that the level of medical education would be rising throughout the world instead of some parts who cannot have access to, American medical education.
Yes, I think definitely. There are a number of collaborations I'm aware of between Stanford faculty and people throughout the world, Rwanda and Africa, for example, and India, that I think will do exactly what you mentioned and really provide resources that will be really allow their own curricula to flourish and take its own local character, but also draw from the kinds of advances in terms of education technology that we've seen in the United States.
Now, Berkeley has also been involved in massive online education. They were the first, in fact, with that physics course that reached the masses. There was a physics professor at Berkeley who taught. Can you comment about that and all your studies in computational research that you did as an undergraduate?
Yeah, so at Berkeley, I was involved in research in computational biology. So there, we created a tool that would help simulate some biological processes, and that could potentially help researchers study more about the body. Are there any other tools like that out there?
Great question. So yeah, I think there's a huge role of our knowledge in computational science that has great potential benefit for patients. And so some of it comes from being able to understand, that is, modeling is really involved in kind of creating an ability to understand what is happening inside the body, and using mathematical analyses to do that is really important. So for example, some of my colleagues at Stanford have looked at flow patterns. That is, they've looked at how blood flows within the body in a way that one couldn't do otherwise. So they combine imaging, for example, with an understanding of physical properties and mathematics to be able to understand these kinds of things. So the role of computational modeling, in my opinion, is really very large and can really do a lot in opening up new avenues of treatment and understanding of the mechanism of things. Also, it was mentioned that in terms of using computation to deal with very large amounts of data, one of the things that I think characterizes maybe our century is the explosion of quantity of data. So that's true in all of the information that we have access to now that we didn't before, but it's really true about our understanding of science. So for example, one of the things you're probably all aware of is the ability to determine the genetic components, the genetic sequence of every human will become possible. So that will create an immense amount of data. So the ability to then compare individuals, to look at the number of permutations that are possible is truly immense. It's really beyond our current comprehension in any of our computational techniques at the present time. We don't have the ability to handle that amount of data in the way that is probably fundamentally possible. But in the future we will. We'll be able to really unlock all those relationships that exist between different components, different observations that we'll make based on our understanding of things like the genetic sequence of humans. So the computational analyses will be very large. It's become a field in itself. We call it bioinformatics is one aspect of it that is a specific form of computational analysis. So the way to handle the so-called big data will be a big challenge for us, but one that I think we're very much ready to undertake.
Before we started the studio filming, you had mentioned that one of your Stanford colleagues had created a program where if you're indigent and you want to see a dermatologist, it's very hard to gain access, and they are taking pictures and they're sending it to a dermatologist, so it'd be cost effective. Tell us a little bit about that.
Sure. There are a number of examples where people are using now readily available technology. So cellular phones are available throughout the world. The numbers are staggering. More people have access to cell phones than they do electricity. So it's really something that I think people will have access to throughout the world as well as in the US. And so people are looking at different ways of improving healthcare as a result. This is, I think, a rapidly changing, expanding area. Some people call it the field of mobile health. And that's an area where I think people are really excited about because we know about the technology. The technology is available. It's really now the challenge is to create systems and tools that really bring the user and the technology together and find ways of making that happen. So, for example, people have created these ways of creating better access. One of our big challenges throughout all of healthcare is getting access to a medical opinion. We may want it pretty quickly, and it's very hard. So with the existence of new technology, we might be able to transmit an image to our physician or to a service where we couldn't before. And so that kind of physical data, whether it be a picture, information about your heart rate and temperature, an EKG signal, all those kinds of things will be now available remotely and be able to, in fact, be something that physicians, without being with us, can in fact keep tabs on us and find ways in which they can identify problems earlier rather than waiting for later in the course of disease.
Now, in your public health time, can you identify certain problems that would be amenable to social media or like the questionnaire you created?
Yeah, you know, and specifically in Iowa, there's a large rural population, and so we've seen this like kind of event of telemedicine start, and you know, it's basically a Skype conference, and then I've heard there's even, you know, some, you know, you can write prescriptions over following these, you know, Skype conferences with your physician, you know, and I don't know exactly the details, but it's really incredible when you can do that and reach someone who is several hours from a medical facility that would not, or doesn't have a car, or doesn't have the ability to actually get there. It can, you know, really change their life, and so that's really exciting. That's what I've seen in, I guess, in community health in Iowa. So
yeah.
Well, radiologists already do telemedicine. They have people on call. People hire them to just cover the, you know, the midnight shift for ERs, and they could be reading radiology remotely. In ophthalmology, we tried to do this like 25 years ago, and we ran into sort of blockages with HIPAA and informed consent. How do people get reimbursed? But now the explosion is really how to manage this data. I have patients who routinely send me pictures of their eye, and should they come see me. So the challenge is that we have people in Africa who need this, who really need help, and how can we really reach them? So we have 3 minutes remaining. What is our message for our take-home audience? How can they support programs like this across America? How can they make their donations? How can they volunteer? Tell us.
Oh, sure, great. So first of all, I think as you've heard, I think we have every reason to believe we're really excited about what innovations will be possible. I think the way I've looked at things is that we've had a really great advance in terms of technology that exists because of the advances in things like mathematics, chemistry, and physics. So our mobile technology, our ability to use computers is all really based on those advances. And it's really come to medicine in a later phase. And so I think the next 10 to 20 years is really the time when we'll see these technologies, which now are matured in these other areas, really come into play in a really much fuller way in medicine. So that's where the intersection between the technology, engineering, medicine, I think will come really to the fore, and we'll see a much even greater ability to use these advances and to produce, I think, improved outcomes for patients, increase access, and really pave the way to new discoveries and ways to treat patients. So I think I'm really excited about what will be possible.
For every medical school in America, there are ways for patients to donate to the medical school, to further research, to ask your doctors in academic medicine, or to write to your local medical school and see how can we continue innovation. And we need public support. We need the legislators to support us. So we really want to thank all of you for joining us in Health Talk today. Thank Dr. Wang, Kimberly, Evelyn for such a lively discussion. I think that it's important for all of us to understand that innovation is important. It helps all of us. It helps us with breast cancer, with major public health issues, for global issues, because we want, as teachers, as doctors, as citizens of the world, to really help the world, make the world a better place. If you like this show, join us on YouTube, make a donation to KSAR TV. We are very grateful for your support, and thank you for joining us today.